Hi friends, chickenpox. Chickenpox is a typical viral infection, and the virus that causes it has a number of surprising features. First of all, this infection is characterized by almost 100% suspectability, that is, if a person who has not previously had chickenpox comes into contact with the patient with chickenpox, of course at the time when the patient is contagious, the probability of getting sick himself is extremely high. Chickenpox is transmitted by airborne droplet and contact routes, and around the patient there is a huge amount of viruses that can spread with air currents over a fairly decent distance to neighboring rooms, to other floors. That's why first, high susceptibility, and second, volatility of the virus. Every person during his life has the opportunity to repeatedly meet with the varicella zoster virus. Chickenpox. Vaccination against this disease have already been developed, but they are not mandatory. So almost all children sooner or later get chickenpox. Children under the age of 12 are most often infected. And it is at the age that is up to 12 years that the disease almost always proceeds easily. In older children, the severity of chickenpox increases markedly, and even adults get sick extremely hard. From this follow a rather important conclusion about the benefits of visiting preschool institutions, where there is a very high probability of catching chickenpox in time so as not to suffer later. By the way, in some very civilized countries, when chickenpox occurs in the children's team, they do not raise any noise and do not impose any quarantines, so that everyone gets sick in a timely manner. The chickenpox virus infects the epithelial cells of the skin, forming characteristic changes on it. Initially, red spots, which after a few hours turn into bubbles filled with a clear liquid. The life of the bubbles is short. Already on the second day, its contents become cloudy, the surface wrinkles and begins to crust. After 7-8 days, the crusts dry up and fall off, as a rule, leaving no traces. The appearance of a chickenpox rash usually coincides with a deterioration of the general condition of the child. Weakness, refusal to eat, headache, fever. New blisters are found within a few days, 2 to 5. A patient with chickenpox is considered contagious 1 day before the formation of the first blisters, and within 5 days from the moment the last element of the rash appears. What would you like to know? First, at high body temperature, it is with chickenpox in no case should aspirin, acetyl salicylic acid, be given as an antipyretic. There is a high probability of complications from the liver. I emphasize, not aspirin is a bad medicine, but a combination of chickenpox and aspirin. Secondly, with chickenpox, a child is often worried about skin itching, and scratching the blisters greatly increases, firstly, the risk of bacterial infection, and secondly, the likelihood that traces will remain in place of the blisters for life. To combat itching, doctors prescribe sedatives, and parents should first distract and entertain. Second, most carefully monitor the nails, cut of course, and small, that is completely unreasonable, put on mittens. Third, daily change linen and quite possibly organize a bath. After the bath, of course, soak, not wipe. In passing, we note that in relation to baths, the opinions of doctors differ. American pediatricians consider them very desirable. In some countries, they are categorically against bathing. In some countries, they are categorically against bathing. The truth apparently is somewhere in the middle. The stronger the itching and the warmer the room, the more necessary the bath, again given the itching. I strongly recommend avoiding overheating in every possible way. The more you sweat, the more it will itch, no matter what you do. Good health, and see you soon.